Good morning. Okay, last question for this morning comes from Christian. Good morning. Yeah, interesting question. All right, let's try it. So, hey Ben, can COVID positive healthcare workers isolate with COVID positive patients? Could we create a COVID colony where patients take care of each other? Yeah. Ugh. Yeah. Is that extremely dystopian? Yeah. Or just a little bit. I don't know. But yeah, there is a point there. Yeah, if you have anybody who is, yes, going through COVID and has the active infection in them, theoretically, you would think, yeah, all right, anybody can be in there, they can take care of each other. But what we don't know is whether, like, a repeated high dose of COVID after you already have COVID can potentially worsen the situation. I bet there is somebody who has done something like that in animals. I need to go and look that up because I do not know the answer. Normally, you just give the animals one dose, and depending how high the dose is, like the high doses will usually kill the animal, the low doses, the animal doesn't usually even get sick. And somewhere in the middle, you can find some kind of dose that gives the animal enough disease that you can actually try to treat the disease and show that you've done something useful. That's, yeah, the weird mechanics of antiviral and/or vaccine research. But yeah, this COVID leper colony, that's interesting. I wonder. I don't know that you could rely just on COVID patients because they would be experiencing roughly the same symptoms and severity of symptoms in the doctor nurse group and in the regular people group. And so I think you would probably have to supplement that with other people that would go in and help take care of them. And the stress of trying to take care of somebody while you're going through COVID could potentially lead to higher deaths among the healthcare workers, which are the ones we're trying to use their skills to help other people. We're not trying to eliminate them because that would make the problem worse, I think. The idea that, and I've still only seen this one report of it, but the idea that high cortisol stress hormone levels predict bad outcomes in coronavirus. That hasn't been fully, we don't know when the levels have to be high, if it's, beforehand, if it's like a hereditary high level, if it's a person that just always is a little bit on edge. We have no idea, but I can't see a way that stress would make it any better for the doctors or the nurses or whoever, healthcare professionals. And so, no, I think for their sake, it would be nice if you could just use that to, yeah, right, take care of everybody safely. But I think for their sake, you're putting them at extra risk when they've already gone out of their way to be at extra risk in order to help other people. So I would recommend against that on those grounds. Yeah, the unknowns are potentially bad enough, and the knowns are definitely bad enough that, yeah, I wouldn't do it. But I like your thinking. It's an interesting idea. Yeah. And, yeah, yeah, yeah. Keep thinking, keep going. Try and stay positive, but not COVID positive. All right. Thanks very much. This is Ask Dr. Ben.